Hello, my name is Ann Robinson. I serve as the immediate past board chair for the Institute for Child Success. Thank you so much for joining us today as ICS celebrates a decade of impact. We've come a long way since being founded in 2010. ICS started off as just an idea, a belief that we could do better for the youngest children in our community if we focused on data, research, and applied policy. At the time, it was admittedly a little outside of the box. There was no one in South Carolina like us, and we still are unique. What began as a one-person nonprofit startup based in Greenville, South Carolina, has transformed into an organization with 10 full-time staff and 3 fellows. We have worked in a majority of U.S. states and are responsible for over $450 million new dollars going into early childhood ecosystems. ICS serves as an incubator for new knowledge, a clearinghouse for the most up-to-date research, and a trusted advisor to governments, policymakers, foundations, and nonprofits seeking to improve outcome for the children they serve. It also continues to provide innovative thought leadership and opportunities for professional development, training, and education to the field. ICS cultivates early childhood ecosystems by helping individuals and organizations co-create a better, brighter future for the next generation of children. Today we'll look back at 10 years of impact at ICS and what the future holds for our organization. A special thank you to our sponsors for today's event, the South Carolina chapter of the American Academy of Pediatrics and Kincaid Retirement and Wealth Management. Thank you again for joining us on this journey, for your past and future support, and for believing in our vision, the success of all children.
Hi, I'm Dr. Desmond Kelly, board chair and one of the founders of ICS. I am so proud of what ICS has become in such a short amount of time, and I'm even more excited about what the future holds. Over a decade ago, I and other leaders from our health system started meeting with early childhood leaders and advocates in Greenville County to discuss how our state could and should do better for our youngest children. At the time, the statistics were discouraging. We were consistently among the worst states for education, maternal and child well-being, access to services, school readiness, literacy, and other critical measurements. Yet the disheartening data were not due to a lack of effort. Many health, education, and other leaders in our state were working hard to ensure that all children could thrive. Doctors, childcare providers, philanthropists, faith leaders, educators, early childhood professionals, the business community, and individual families alike were all doing what we could to create an environment where children could succeed. However, we realized that in spite of our efforts, children across the state were not afforded the same opportunities as their peers in other states. There were critical inequities in our systems, and so much unlocked potential that could turn around a well-intentioned but underperforming system. And so we dreamed big. We asked what could be done to move South Carolina from among the worst in early childhood to one of the nation's leaders. We brainstormed an education center, a child care and training hub, and countless other iterations. But what we eventually realized was that more direct programming was not the answer. We needed systems change. We needed an organization that would pair research, policy, innovation, and strategy to help the entire early childhood field work together, share a language and common agenda, and move forward as a group. Back in 2009, I admit that this idea was a bit out there, but I think our work in South Carolina and 27 other states over the past decade speaks for itself. I'm so proud of what ICS has accomplished. It truly is a dream that continues to come to fruition each passing day. Because of ICS, families in South Carolina have access to Help Me Grow South Carolina, Nurse Family Partnership, and a state earned income tax credit, one of only 3 in the Southeast. Because of ICS, more children in our state, Arizona, and Tennessee have access to 4-year-old kindergarten. Communities in numerous states are better prepared to implement Pay for Success. Pediatricians and educators have a better understanding of implicit bias, and policymakers nationwide have better information to make decisions that benefit children. In addition, I'm very proud of ICS for its annual co-hosting of the Nurturing Developing Minds Conference alongside Prisma Health. This professional development conference attracts a wide array of nationwide participants and provides an interactive learning and networking opportunity for a broad, interconnected early childhood workforce. But it is the people of ICS that I'm most proud of: our board, our staff, our donors, and our partners. We lead with our shared values: nonpartisanship, integrity, equity, humanity, innovation, partnership, and results. And we put humans first, especially the littlest ones and their families, because we recognize that in the complicated, resource-finite world of early childhood, a trusted, neutral, and research-based organization is critical to child success. Therefore, in our second decade, as we move out of startup phase and into a growth phase, we aspire to be a technical advisor, trusted counselor, innovation partner, and strategic expert for all parties interested in early childhood. We aim to add value to any partner whose mission puts child success first. We want to help incubate innovation, promote collaboration, and break down the structural barriers that prevent children from accessing the opportunities they deserve. And we seek to help communities of every size cultivate their early childhood ecosystem in order that all children in every community have the opportunity to thrive. Most importantly, though, we believe that this dream can come true. All children everywhere can succeed if those of us who are morally responsible for their well-being can work together. The dream of success for all children should never have just been a dream. In fact, all children deserve to thrive, and we should be doing everything in our power to ensure that it happens. Thank you for joining us today and for playing a vital role in the success of all children.
Thank you, Dr. Kelly, for those moving words. Your vision and that of others has led to so many success stories for children across South Carolina and the nation. And it's so important that you highlighted that child success isn't just about test scores. It's about children thriving, which looks a little different for every child. As a mother of 3, I can say that each of my children thrives in their own unique way. Joining us next is someone who has also been with ICS since its earlier days. He will share some of the successes he helped bring about over our first decade. Please welcome ICS President and CEO, Jamie Moon.
Thank you, Ann. Over the past 9 years, I have been privileged to serve as the President and CEO of the Institute for Child Success. I can still vividly remember my first interviews with the founding board members of ICS back in 2012. At the time, ICS was just 1 year old, but was already generating buzz throughout the early childhood community in South Carolina with its novel, systems-based approach to solving some of society's most pervasive challenges. One of the most profound takeaways I had in my early meetings with the visionaries who created ICS was this simple yet profound declaration. In addition to the many ethical and social arguments for investing in our youngest children, investing in the next generation is also critical to our collective future prosperity. This is because when we fully invest in healthy, comprehensive early childhood development, we can expect to see our children grow up to be productive workers, responsible citizens and parents, and fully participating members of our society. However, when we fail our children, all of us pay a price: a diminished, insecure, and less prosperous society. The passion and energy that the founding board brought to the creation of ICS led us to approach early childhood challenges in innovative and pioneering ways. Alongside tools traditionally associated with optimal early childhood programming, such as a focus on quality and the proliferation of evidence-based interventions, we also explored tax policy, pay-for-success financing, the role of the built environment, and the ways emerging medical legal partnerships could move the needle and improve the lives of children and families. As we went about our work and started to see success in South Carolina, we began to understand that the challenges facing young children were not unique to the Palmetto State. The Institute's work in catalyzing the expansion of evidence-based home visiting models in South Carolina through impact financing caught the attention of Washington, D.C., and we were soon engaged with dozens of jurisdictions across the country in providing pay-for-success technical assistance to help these communities as they attempted to solve early childhood challenges unique, but in many ways similar to the challenges we faced in South Carolina. What started as a research policy organization focused solely on South Carolina was now an organization both learning from and offering assistance to other parts of the country. At the heart of all ICS work is collaboration, and it is through collaboration with our many partner organizations that the majority of our impact has been achieved. Early on, we joined with the Children's Trust of South Carolina, the United Way Association of South Carolina, and the Save the Children Action Network to create the South Carolina Early Childhood Common Agenda. This effort provided a unified voice to over 35 early childhood organizations at the South Carolina State House and catalyzed several of our biggest accomplishments over the decade. These include the multi-year reauthorization of First Steps, the multi-million-dollar expansion of publicly funded 4-year-old kindergarten, and the adoption of the largest state earned income tax credit in the nation. Likewise, numerous national partnerships with organizations ranging from America Forward to the Pritzker Children's Initiative to the David and Laura Mirage Foundation in Colorado have helped ICS promote smart investments in early childhood in other states and at the federal level. And none of this work would have been possible without our many philanthropic partners. Early on, the United Way of Greenville County and the Children's Hospital of Prisma Health believed in our vision and provided the seed capital to launch ICS. Hollingsworth Funds, the Mary Black Foundation, the Duke Endowment, and the Blue Cross Blue Shield Foundation of South Carolina all quickly followed and remained essential partners today. Other major supporters and collaborators include the Jolly Foundation, Blue Cross Blue Shield of South Carolina, John I. Smith Charities, the Margaret Linder Southern Endowment Fund of the Community Foundation of Greenville, the Sisters of Charity of South Carolina Foundation, the Priester Foundation, Greenville County First Steps, the Bunnell Foundation, and the Corporation for National and Community Service, and the chapter of the American Academy of Pediatrics. In addition to these foundations, numerous individuals have also selflessly leveraged their skill, hard work, and financial resources to developing and sustaining ICS. We are blessed to be led by a board of directors that is second to none, a research committee made up of academics and professionals using their expertise to advance the ICS mission, and a staff that is well known for its rigor and tenacity in advancing the ICS mission to ensure the success of all young children. We often cite numbers when discussing the wins we have shared with our partners over the past decade: a $30 million expansion of the Nurse Family Partnership, a new 125% earned income tax credit, a 10-year federal reauthorization of the maternal, infant, and early childhood home visiting programs, and $450 million in new investments in South Carolina for families and children. However, the numbers don't tell the full story. Because of ICS and the work of our partners, today, a child in Spartanburg County, South Carolina is receiving quality early learning in her 3-year-old classroom. A Senate staffer in Washington, D.C. is reading ICS materials on how tax policy can alleviate childhood poverty, and a single mother and her baby are receiving counsel in rural Williamsburg, South Carolina. South Carolina, these are the stories that matter. These are the stories that demonstrate the impact that we have achieved with your help. On behalf of the many families and children that we serve, thank you all. We look forward to working with you to see what we can accomplish together over the next 10 years. Now, to tell you more about two individuals who were key in the establishment of ICS, it is my pleasure to welcome Linda Breeze, a former ICS board chair and currently a senior fellow.
Hello, and thank you, Jamie. My name is Linda Breeze, and I am one of the founding board members of ICS and currently serve as an ICS Senior Fellow. Although today we officially celebrate a decade of impact for the Institute, long before we officially became an organization, several of us met over the course of many years to discuss the challenges facing children and the need for a systematic organization that could meet these challenges. Two of those individuals were especially critical in developing and sustaining ICS, Dr. Bill Schmidt and Dr. Susan Schy. At the time of ICS's formation, Dr. Schmidt was serving as the medical director of Children's Hospital of the Greenville Health System, now Prisma Health. Dr. Schy was then the First Lady of Furman University and a key United Way of Greenville County board member. Both Dr. Schmidt and Dr. Schy came together to tirelessly promote and sustain the vision of what would become the Institute for Child Success. They leveraged their personal expertise, their many connections in the philanthropic community, and most importantly, their passion for improving the health, education, and wellness of children and families to take ICS from simply being a dream to making it a reality. Both Dr. Schmidt and Dr. Schy continue to serve ICS as emeritus board members. Their vision, guidance, and dedication continue to propel the geographic and programmatic scope of ICS far beyond our hometown of Greenville, South Carolina, to now include initiatives across South Carolina and across the nation. However, we remain firmly committed to the original vision of Dr. Schmidt and Dr. Schy, ensuring the success of all children. As a way of honoring the many contributions of Dr. Schmidt and Dr. Schy, ICS recently established the Schmidt and Schy Endowed Legacy Fund. This new fund will ensure that the Institute continues to thrive and create positive impact for children far into the future. As friends of ICS, we invite you to acknowledge their dedication by considering a gift to the Schmidt and Schy Endowed Legacy Fund. You may make a gift by visiting the ICS website or by contacting me at the number appearing below. Again, we thank Dr. Bill Schmidt and Dr. Susan Schy for working with our other founding board members to make ICS a force for positive change in the lives of children. And we thank all of you for your dedication and support of our work. Thank you.
Thank you, Jamie. Thank you, Linda. It's truly amazing how much ICS has accomplished in only a decade. The Schmidt and Schy Endowed Legacy Fund is such a lasting and impactful way to both honor two of our founders and support future efforts of ICS. Speaking of the future, rounding out our program today is ICS board member Jokeitha Seabrook, who will join us to talk about ICS next decade, early childhood, and our theory of change.
As an ICS board member, I have been so proud to see how far ICS has come in the past 10 years. In the beginning, it was purely theoretical, but the impact that Dr. Kelly and Jamie summarized is very real and has impacted hundreds of thousands of families in South Carolina and across the nation. The past 2 years have been particularly clarifying for ICS. The COVID-19 pandemic and the summer of 2020 with its generational racial awakening caused ICS to reflect deeply on its purpose, its roles, and its commitment to success of all children. Every child deserves the opportunity to thrive, but the pandemic underscored just how acute the disparities are, even for the youngest children. ICS sees this evidence on a day-to-day basis. Black boys are 3.6 times more likely to be expelled from preschool settings than their peers. Populations of color are at greater risk for experiencing adverse childhood experiences, also known as ACEs, compared to white children. And ACEs are often a result of income inequalities, lack of access to employment, education, and health care, and other generational factors. And these are only a few of many examples. Therefore, the data clearly points us to a North Star. The success of all children is dependent on an equitable early childhood system, such as the vision and mission of ICS requires us to mobilize in instances of disparities, make equity central in our organizational focus. This focus comes as an addition to the existing work of ICS, the cultivation of early childhood ecosystems. Early childhood is dynamic and iterative. As we learn more, there is more to do. And the goal of child success moves forward. This state consists of improvements is a good thing. For example, a century ago, we were unaware of many pre- and perinatal advances we took for granted now. Just over 20 years, we began to learn of adverse childhood experiences. Only 2 years ago, pre-COVID-19, fewer of us were aware of the critical foundations that childhood play in not only child development, but also workforce and economy. We learn, we conceive solutions, we apply them, and children are better off as a result. And we know investments into early childhood yields upwards of a $4 to $1 return on investment. Yet, it is not as easy as it sounds. The early childhood ecosystem affects nearly everyone, yet no one party is solely responsible for its success. This is because early childhood ecosystems exist within, depend on, and affect largely non-early childhood systems, business, health, and educational systems as examples. After all, there is a reason people say it takes a village to raise a child. That village or ecosystem has to work in a way that benefits children, enabling them to thrive, provides them opportunities, and ensures their success. We all play a role, but it can be hard. Prioritizing agendas, silos, paradigms, short-term thinking, just a few barriers that are being named, and many of them are well-intended. However, as successful cultivators of early childhood ecosystems, ICS has identified a roadmap of success based on its significant experience providing technical assistance to communities. The roadmap has 3 codependent parts: stakeholders, values, and process. The drivers of the success innovations are stakeholders, which in ICS's experience must include all parties. This group includes, but not limited to, families, health professionals, early child care educators, the broad educational system, the business community, government, nonprofits, faith communities, and philanthropy. A diverse set of stakeholders will net more sustainable, efficient, impactful, and equitable ecosystem. Fueling the efforts are the values of equity and innovation. While these are not the only values an initiative can have, they are 2 of the most important. Equity, as we've mentioned before, is important because an inequitable system will result in a zero-sum situation where some children will thrive and others will not. Innovation is a vital ingredient because we must be willing to try new things, take risks, and rapidly evolve. As I mentioned before, continuous improvement is a good thing, and innovation goes in tandem with it. The third part is process, which is both iterative and continuous. First is analysis, understanding the context of the ecosystem. It is a step that is fundamental, cornerstone. Imagine that you need to go grocery shopping. It's always best to take an account of what is in your pantry before making a list. Many of us may just brainstorm in the car on the way home or from work, but those 5 cans of expired beans in the pantry suggest maybe an inventory might be helpful. After analysis comes the plan and research phase. Once the context is understood, innovations can begin looking more deeply into a specific set of questions. In tandem, they can form a plan for what the research points to as the most optimal steps relative to the context. Take this second step is going to the grocery store. With a list after making an initiative inventory, you walk out within budget and with exactly what you need. Moving forward without it is going to the grocery store when you're hungry. You probably don't take inventory. You might get some of what you need, but it is in the addition to all things that end up in your buggy. Next is policy and program phase. These go hand in hand. Sometimes programming is needed. Sometimes it's good policy. Most often it's both. This is usually where innovation begins, hearing of something that works somewhere else and wanting to replicate it. That can work, but not without the first 2 steps. I promise that this will be the last time I use the grocery metaphor. It's like once you have done your inventory and you made your list and you plan which grocery store or grocery stores you need to go to, otherwise you will end up starting at one place, going to another, only to find yourself back at the original. It's a waste of time and money, and it's frustrating. The next step is fund. While there is no tried and true method of securing funding, we can attain that in our experience, the innovations that go through steps 1 through 3 more readily find funding than those that do not. In addition, this step highlights how crucial the engagement of a full set of stakeholders is at the beginning. The more diverse the group, the wider the network is for support. ICS specializes in providing technical assistance and a specific kind of funding, pay for success, or more broadly, innovative financing. This is a method that pairs private investors with public entities, providing financial capital for evidence-based programming. Upon achievement of specific outcomes, investors can even receive return on their investment. Finally comes measurement. Once the ecosystem is up and running, it's always important to measure. Once you take account of your pantry, make your list, and complete your shopping, it's good to know what your food tastes like. And then, in early childhood ecosystems like the grocery shopping, the wheels turn again, and we start back at the beginning, engaging stakeholders, defining values, and going through the process again. Like Dr. Kelly said at the opening of our event, ICS aspires to be a technical advisor, a trusted counselor, innovation partner, and strategic expert for communities as they develop their early childhood ecosystem. We want to help incubate innovations, promote collaborations, and break down structural barriers that prevent children from accessing the opportunities they deserve. And we seek to help communities of every size cultivate their early childhood ecosystem in order that all children in every community have the opportunity to thrive. So pick up the phone and give us a call or visit our website and send us an email. We work to ensure success for all children, and we won't stop until every child is thriving. We would love to be your partner in making that happen in your community.
Thank you, Jokeitha. That makes so much sense. I'm excited for what the future holds. As we wrap up today's event, I'd like to thank you all for taking time out of your day to join us virtually. In just a few minutes, we will be releasing our 10-year impact report electronically, so please keep an eye on your emails. This document will summarize our history, our past impact, and our theory of change. As always, please visit our website, instituteforchildsuccess.org, for more information on how to engage us for your community or organization and to offer support. We wished we could have been in person for this occasion, but we'll only make the next one even better. Until then, stay safe, and thank you for your continued effort to ensure the success of all children.